Hi, my name is Preston Tang. I work out of Las Vegas, Nevada, and I'm part of the NMAC Asian Constituent Panel.
Hi, my name is Mackie Bella. I'm with the San Francisco Community Health Center.
My name is Danielle Miguel. I am working out of Oakland, California, and I'm also part of NMAC's Asian Constituent Advisory Panel.
Hi, my name is Ignalino. I'm from San Diego. I work for Family Health Centers of San Diego, and I'm also part of the Asian CAP.
And my name is Aono. I'm based out of Los Angeles, California, and I'm also a community health educator, and I'm part of the API CAP as well.
Talking about sexual health, sexuality was never part of my upbringing. I grew up in a very Catholic family, a very religious family, and I know it's uncomfortable. I know it can be challenging to have those type of conversations with your family members, but it's critical to have an open dialogue, to destigmatize HIV, STDs, and have open, frank conversations about sex, sexuality. Everybody does it. It's part of human nature, and the more we talk about it, the more we destigmatize it and create a powerful community that empower and support one another.
So a lot of the people that I work with tend to span different types of generations. And in terms of just introducing the whole concept, I kind of meet them where they're at. If they're on the younger end, especially me working at a community health center and working with patients who are mainly young adults, teenagers, I think tapping into the media to kind of bring up conversations around sexual health, HIV, STI testing, family planning, it always helps to kind of get a sense of where they're at, what they see on social media, what they see in the movies, the musics that they listen to, and then getting a sense of how they have the conversations at home. Do their parents talk to them? Do their aunts, uncles, grandma, grandpa, whoever around them talk about it in terms of not just like, oh, are you going to have a child? Especially in the Asian culture, they tend to bring that up when they're ready to have grandchildren or have nieces and nephews. I like to see what it looks like for each individual's family life, but also what they consume. So just tapping into that, getting an understanding of what they're consuming, how they're interacting with others around them, if they're having those conversations with their friends, it really helps me gauge on what type of resources to tap them into, and then also what type of education or opportunities of engagement to introduce them to.
I think that's a really great question. I think for me, to celebrate Asian heritage or to celebrate HIV/AIDS Awareness Day, I think we have to stand in the fact that we're Asian and we're queer and that we celebrate ourselves, and that kind of resonates to everyone, right? And it resonates to people, and to find joy in who we are. And even though we may have some backlash, or maybe there might be some kind of feelings that people feel about us being Asian and queer, that we still stand firm in who we are. And I think that really does spread, because you cannot give from an empty cup. So if you don't love who you are, and I love being an Asian queer man, that's just gonna go to everyone else around me. And whoever accepts it, that's whoever accepts it.
I think it is kind of a sensitive topic, especially because I do identify as a openly gay, queer, Asian person, right? In our household, we never talked about sexuality. We never talked about HIV, anything preventative. And I feel that from what my personal observation is, I see that the media portrays, like, you'll notice, like, on TV, you'll see a lot of trans people, like newscasters and on TV and interviewing on, just on the media. But then when we talk about it, it becomes more taboo now. And I think as a health educator, I have to find a way to kind of bridge that gap. And I have to find a way that I could spark an emotional response from them. So I give them little nuggets, little by little. And then finally, when they start asking questions, that's when I start introducing everything to them. I need to find a way to kind of make it relatable. Mm-hmm. Yeah. It really depends on the age too, right? Yeah.
So I work out of San Francisco, and one of the populations that I work with are specifically young adult Asian queer men. And in San Francisco, even though it is a majority like API city, a lot of the spaces cater to white cis men, and specifically like in the gay community, it's very much oriented to white cis men, and oftentimes, the clients that I work with, the Asian queer men that I work with, a lot of them are not from the area, so they don't have like that family support, and they come to my program for community, and with our program, the connection from San Francisco Community Health Center, we try to provide a space where they can both explore their queer identity as well as their Asian heritage. So, for me, I definitely want to like push that, you can be both. Like, you can celebrate both being gay and also being Asian, and like, you don't have to choose, because in a lot of queer spaces they make you choose, and in a lot of Asian spaces, with the culture being very conservative and traditional, they also make you choose, like, okay, you're either like Asian or you're gay. So that's definitely something that we try to work hard to do, is to provide both those spaces so that they can enjoy, exploring the intersectionality of their identities.
I personally believe that being in multicultural settings or like multi-identity settings helps a lot. And being part of coalitions, whether they're official or not, also sets that tone for what solidarity looks like and what it means to advocate for not just ourselves, but for one another. So for me, at least considering organizations and what it means to collaborate, it always goes back to, are we promoting the work that we're doing? And are we engaging with other spaces intentionally, right? Especially because, we could sit here and talk to our like usual colleagues, us five. We've seen each other in multiple spaces. We're coming from different parts of the country. We're doing very similar work. But if we're going to be repeating the same stuff to one another, it's just an echo chamber amongst ourselves. If we're engaging with allies or even just acquaintances from other spaces, right? And just learning about what they do, seeing where we relate, and promoting ourselves to their work, or even tying ourselves to their work, I think it makes it a lot easier to kind of just lay out that foundation to push forward, not just for ourselves, but for their own agendas, right? But yeah, setting intentional campaigns, being intentional about the work that's already being done too, so we're not just reinventing the wheel. And then on top of that, being very intentional about how we support one another, not just amongst our own orgs, but in terms of who we're reaching out to and what type of demands we have for our own goals. Because everything's always changing with the different pandemics going on, especially in terms of like addressing sexual health during COVID. Like, we know people are having sex. We know we want to promote prevention. But on top of that, we also want to be able to have conversations during that time of isolation, right? So yeah, for me, it's just mainly tapping into communities while also being able to support one another in that goal of ending the epidemic, but also preventing anything else from happening.
Just to kind of piggyback up what Danielle said, I feel that visibility is really important. I think one takeaway that I learned from this biomedical prevention summit that we attended, Ben and I, we were so emotional because we've been doing this for a while, and this event had the most people like attending, and I think part of it was, we've been doing it, and our intention is there, but we never were able to get it successfully executed. And for the event today, we had people, we had a lot of people who attended, but even afterwards reaching out to us, and before and after, saying, oh my God, like everything that you said, it identified with me, and everything that you said, it hit home, or everything that the title itself, it's who I am. And I think the important part is, yes, being able to bridge that gap, but also having that visibility, like saying, hey, we're here, don't forget about us, we exist, and we're just like you, so come on over and let's build connections with each other and hold each other accountable. And you're right, we were able to create that space to just kind of build that relationship with each other, and I think it really gets, I don't know how to say it. It's like really important because we all build that relationship with each other, and then I think it's going to grow from that point, right? Yeah. Yeah.
I was just going to say that, I think what you were saying really resonated with what we learned about yesterday is, and what I've learned from people in general is that, our work really needs to be intersectional. Mm-hmm. And I was a part of the Gay Men of Color Fellowship meeting, and someone said something that I will never forget. They said that my liberation is dependent upon your liberation. Wow. And I think about how deep that means to the kind of work that we're doing in HIV prevention, but it really crosses all boundaries. And so we talk about the bridge, the bridge is also supporting other organizations, but also other communities that we may not identify in, but making sure that we're being intentional, genuine, and authentic.
Right.
Like one of the interventions that we do for my program is that we go out to community settings, clubs, street fairs, and we promote specifically like queer Asian programming. And I think, a lot of times when we're talking about minority health and like minority issues, we talk a lot about representation. And it really does matter, and it really does when you see people that look like you doing things that you want to do, it's kind of empowering. And even when even in San Francisco, we have a lot of community members who are still conservative about their sexuality and are not very open about it. And us like being in those settings, trying to promote like, hey, like it's normal to be like Asian and gay, and like we are around and we are doing these things. It like really helps people like kind of come around and like feel normal about like their identities, and kind of help them like get over like that self-oppression. And I think another thing too is like, you have to be consistent in that representation, because if they see you once or twice, it's not really going to matter. But if they're seeing you all the time, like every single event, and they're seeing that, we are part of the community, we are, here to stay, then it really reinforces like that idea that it is normal and it's okay to be Asian and it's okay to be gay.
Data feeds projects and efforts across the United States, and federal dollars are allocated based on demand and needs. When data only shows that 2% or less than 1% of Native Hawaiian and Pacific Islanders are accessing care and resources or HIV treatment or care, it doesn't truly represent the issues that goes around in our community, and it's not a fair representation of what's going on. If you actually look at the CDC website, if you try to look for Asian and HIV, it's gone now. Previously, that data was there, and I think it was published in 2016, but bear in mind, data takes time to research. So if it was published in 2016, then data that was produced from 2016 was from 2012. That is not a true representation of what data is today. We've now gone through a pandemic. We've now gone through other societal issues that has changed the landscape of where we are in America today. So there's resources that needs to be allocated to serve the API community, but until resource is allocated, there will never be research being done in those communities. And until those resources are allocated, then it's gonna be a perpetual cycle. So it's really challenging.
And I want to piggyback a little bit about that, because the data that we saw, it is significantly skewed. There are so many confounding factors that factor into that, because as API community, we get clumped into others. So as far as preventative funds, we're very limited with the resources. If you're thinking across the nation, they clump the API community with the Native Hawaiians, with the Native Americans, Alaska. It's all in one. And exactly, you said about 2%, correct? Well, as far as preventative funds, the last I heard is it's like $5 million to spread throughout the nation through all these community members. And how is that supposed to how is that supposed to support any type of preventative resources or any type of services? That's very limited. And then if for all of us, we're all community organizers by heart. It takes money and it takes effort. It takes manpower for it to happen. And when obviously we want to do it, but it puts us in a position where it's like, hey, do I pay the bills or do I get paid the very little jelly beans to survive? And obviously we want to do it, but it's like it almost becomes like a catch-22 for us. It's a difficult position for us. But honestly, I think all of us have done a lot of sacrifices already in this work, because I've personally, just being able to connect with the constituents and all the community members out there, it's like, how can I say no to you? How can I say no when me and you're my brother, you're my sister, and you clearly need the resources. You don't have the navigation services available. And if I don't help you, you're lost. And that's where I think the accountability part happens, and just the visibility. And I think we do this work because it's our heart, yeah.
When I think about visibility, it is, of course, in the data, right? But there's also visibility in the way that people market their prevention programming. Right. And so I think one of the things that I've seen from Preston is that he actually took a group of his friends that are Asian. I was going to say very Asian. I'm sorry. but they're Asian, and he was using this own stock photography for his marketing materials. And I think that that's important. I think that what I learned from that is that I started to do that with my own programming that I oversee. Is I want people from the community, because I want people to identify and say, hey, I know that person, or I've seen that person. And they're not ashamed to be on a let's get tested together campaign, or let's start on PrEP, or let's start going to mental health or substance use. I want people to visually see that it also impacts our community, and in languages that people are comfortable in. It is always surprising, but not, that we go to all these conferences, workshops, other institutes, and we never see ourselves also represented just in the data. And I've been told by epidemiologists locally in San Diego that it's such a small number, Ben. I don't care. Please put a bar up there to just know that it's possible, that it is impacting and it is affecting everyone in my community. So I think about it in two different ways: the way we market and how we show imagery, and to show all of Asian culture, that we come in all different colors, our hair is very different, our languages are very different, our traditions and foods are very different, and that we celebrate that.
So in terms of visibility and data, I just think it's really wild, because Asians are here in plain sight. We're sitting right in front of you. We're out on the streets. We have whole communities, Chinatowns, little Manilas, little Saigons, everywhere across the country. And it's just so bizarre to me, considering the fact that all of these agencies that promote data, promote, health education, promote understanding and being aware of HIV, of sexual transmitted diseases and infections, of all these different sexual health issues, they put out information, but the visibility factor is not there. I just find it so weird that you could have information that was up from 2012 and then just completely erase us from a website, right? And it takes people like us who have been in the work to notice that and to create noise. And then on top of that, it's not just about being Asian, it's about understanding the intersections, right? Understanding that there are queer people who want to see themselves in this data. For me as an Asian woman, it's really weird, because I directly work with young Asian women patients in my clinic, and they're involved in the sex trade, they're being trafficked, they're survivors of domestic violence, they're talking to me, asking me why they're getting infected consistently, or they're asking why there are no women providers to have those conversations with them. So it's not just about the data for me, but also the connections that drive people being intentional about that data, right? And getting not just professionals involved, but also community members to understand, you are not invisible. Like, you're experiencing these things. This is the education around it. But when you're looking up stuff online, you don't see yourselves. And there's a reason why. It's just like what Ben was saying, like, it might be a small number, but seeing a bar, seeing that there's something there to acknowledge their existence and their experiences and validate what they're going through is very, very important. And I think it's so interesting when I'm having these conversations, especially with young patients too, and they're barely getting introduced to these type of topics, whether it's like family planning or just like understanding what it means to be sexually active. They're always asking these questions, but they say that they're scared because their family's not bringing it up. Or even if they're in the clinic, their provider's not bringing it up. They're like, oh, you're not at risk. They're doing the screenings, but they're not delving into what it means to navigate the world within their different identities. And I think that really matters when we're looking at data, but also when we're pushing for visibility, especially for those who have these other layers that go along with being Asian. And I think just action-wise, it really just takes being intentional about how you're hiring within different agencies, being intentional about like what it means to gather data, because we could find numbers, but then they're always going to be skewed in some type of way, depending on what population is being looked at. And that's another thing too, because we're not a monolith. Different Asian regions have different cultures. Shoot, even me as like a Filipino, there are different regions that have different languages too. So having access to the education is important. Having access to people who not just look like us, but also speak like us, who have similar religions. Like you talked about growing up in a Catholic household, that might look different for people who like practice different like religions, right? So it's really important to acknowledge that there are so many different like ways to, different intersections, but ways to navigate the world. And just because we're Asian, it doesn't mean that all of our needs are the same, especially because when we're looking at the data, we don't see ourselves. It really goes back to, we want to value the numbers, of course, but we also want to understand the stories and what it means to cater to the different needs of each community, especially because we're working out of different locations in the US. Things that we get in the Bay Area might look different for LA, might look different for Las Vegas. And while we're still connected by this drive to promote Asian visibility, it always goes back to, okay, what are our community's needs at the time? And also acknowledging that the times will change. People will have access to information, people will be missing information, but also, there's going to be a change of leadership too throughout the years.
So I think that's a multifaceted issue because there's a cultural component to that, but I also want to say that there's a educational and professional component to that. And I think you can probably speak on this as well, Chris, but I actually started my career in healthcare in nursing school. I did not complete nursing school, but I vividly remember when we were learning about like population health, like textbooks literally tell you that certain populations are at a higher risk for certain things. So you should basically profile patients based on their background for certain things. And like when it comes to like Asian health, there's nothing. Like they're not telling you anything about Asian people. Like so there's like that reinforcement in the educational system, in the professional system in healthcare that basically is saying like you don't need to pay attention to Asian people. You don't need to pay attention to them and they're low risk for everything. You have to focus on other minority groups because they have a higher risk for chronic conditions or infections. And I think as much as like that's kind of going towards the direction of health equity, and that's important. It's also like stereotyping, right? It's perpetuating stereotypes and racism, right? So there's definitely like biased in our education for healthcare workers, healthcare professionals.
I think it's really important to recognize that us, because I know I don't want to speak on them, but I am, my parents immigrated to America because of the land of opportunity. I think it's important to recognize that a lot of our API community members are immigrants. Some of our family members maybe came from the city or maybe some rural villages. They already grew up in an area where they don't recognize preventative services. Something so simple like a flu shot, they don't know what that is. HIV, they don't even know how to spell it. They don't know. And so when they come here to the United States, not only do they have to navigate the world the new environment that they're in, but we also have to recognize that they don't know about healthcare. And so it's important for us to, yes, raise the visibility, but also speak their language to let them know that it is okay. And we have to look at all the other variables. Just to mention, like I was working in the hospital and I was a triage intake nurse. And we had a patient come in and they tested positive for HIV. And I remember the medical provider came in and they said, okay, we're just going to refer them over to infection control. And I said, okay. It was out of my scope. I have to stay within my job. But I went in the room and I said, hey, I just want to let you know, like, here's the services. Let me give you some navigation work. I had to do that. And he did write a letter to the corporate office and I got called in and I thought I was going to get written up. And lo and behold, he wrote a letter and he said, if your staff member, Chris, did not come in here and talk to me, I was planning to go home and kill myself. And it's those little efforts that we have to be able to recognize that not every intervention and clinical diagnosis will always be the same. You have to be able to recognize that person's cultural heritage, the things that might be a barrier to them, and then we have to also be able to develop some sort of intervention that's going to cater to their needs in a way that they're going to understand it. Because not everybody will have the same definition and perception of health. Everybody will have a different meaning.
I think it's interesting because then we're talking about what the health workforce looks like. And then on top of that, we have to consider, the interactions and the power dynamics that happen when people are being met in different clinical exam rooms, right? People are already scared of those in white coats, whether they're a nurse practitioner, a doctor, a PA, just anybody in the hospital setting. It makes them feel tense, or a clinical setting. It makes them feel tense. It makes them feel like they're not understanding, obviously, hospital medical jargon. And then on top of that, if they ask questions, there's the shame factor that comes into play. And I think that really affects the way that people interact with conversations around HIV. They already experience that taboo on like a societal level. Nobody's talking about it in media. If they are, then they're not seeing themselves in that. And then on top of that, if they're having those open conversations with those that they do feel comfortable about, there's always that boundary that's set. Like, for example, I'll just use my personal experience. With me and my friends, it's easy to talk about sex, but it's not easy to talk about STIs, HIV. It's always a little bit more to even bring up the question, like, when was the last time you got tested? Oh, do you know about PrEP? Do you know about PEP? Like, those little things. And it's very interesting because the ones who are usually bringing it up are usually the friends who are involved in healthcare or in the medical field. So then it becomes that weird issue of being in an environment where, like, oh, you're talking to me about that. It's like I'm one of your patients, or I'm somebody that you're seeing at your job. And it kind of just builds that wall between people that are close. And I think that's another thing that serves as a barrier in terms of what it means to build community. Because even with our own loved ones, whether they're friends or family, the conversation is hard. And then when you put that extra layer of professionalism, or like, I guess, the field of work that people are engaged in, that disconnect happens. And it's like, well, shoot, I have to start over again. I have to figure out how to communicate with them without making them feel awkward, or without making them feel like, oh, I'm such a know-it-all, right? And, just considering the things that we brought up earlier, when we're talking about what it looks like to acknowledge and like think about the workplace setting, it's really about setting a tone of comfort, just like what Chris did with that patient, and making them feel not just like a patient, but a human being that is valued and loved and cared for, because they don't even know what they need, right? It's a moment of shock when we get a diagnosis. They're processing, there's things that's going through people's heads about, oh, maybe I shouldn't have done this, or maybe I shouldn't have done that, maybe I should have talked to this person. And it really just goes back to them as human beings versus them as patients versus them as data points, right? And I think that's core to what we need to look for when we're promoting this type of work, especially within like the medical field and those who are providing clinical services. That's that referral thing that you mentioned in that situation. It's just, it seemed very like procedural, very like on protocol versus, you know, being very intentional and like human-like and empathetic to the patients. But yeah, it really goes back to thinking about those different things. Anybody?
I was going to also add on top of that, beside in the healthcare realm, seeking services from community-based organization, there's already such a stigma around Asians seeking services, seeking assistance, because you're like, oh, I don't want to seem like I'm not a human being. I don't want to bring shame to my family. It's okay to ask for help. And making sure those CBOs are very intentional with not only their marketing, their visibility, but also the resources that they provide. I'm very fortunate here in Las Vegas that we have an amazing CBO, that ACDC, Asian Community Development Council, that provides a food pantry that gives not only it's a food pantry that has Asian food and very intentional for different cultures. So they had one for Asian Pacific Islander, a separate one for Indian food, where it had special different curries and powders that an Indian family would use in their household. So, yeah, being very intentional with creating those spaces and creating support services that target those specific communities. I think for sure for us to end the epidemic, we need to be loud, to be proud, to make sure that our stories are being heard out there, to share our scars, to share our historical trauma, but making sure that everybody, we count in the data, we count in our in the numbers, and that there's some sort of visibility so that we can all, as Ben mentioned earlier, we all are gonna uplift one another. Every community needs to end the epidemic. It's not one person, it's all of us.
Yeah, definitely raise awareness of the risk within the community, and like just like everybody else, you know, HIV doesn't discriminate, and you know everybody else is just as you know, at risk for it, and trying to, like everybody say, like marketing to the community, marketing to the Asian and Pacific Islander community in a culturally sensitive and culturally competent way. And the best way to do that is representation, right? And consistent representation.
I think empowerment is very, very core when it comes to this type of work, and also acknowledging that everybody has a role, whether they're doing the community organizing, whether they're providing the services, if it's treatment, if it's prevention, if it's just education in general. And being inclusive of everybody in that conversation. I think it's very difficult when we're talking about people of different ages, especially in terms of, you know, touching base with what sex looks like, what substance use looks like, what it means to like engage in these quote unquote risky behaviors, and then engage in the conversations that tie back to, you know, lack of shame. How do you feel empowered? How do you destigmatize? How do you feel whole with yourself when having these conversations, and being inclusive of loved ones in the conversation too? So really just factoring in that empowerment is important, but also that everybody has value in this type of work.
If we really want to end the epidemic, I think that one, we have to show up, even when we're told we're not supposed to show up, and take space and create space, organize, be rah-rah if you need to be rah-rah, right? Because it's important, and stand in it. Stand in the fact that you are Asian, you're queer, you're doing HIV prevention, care, treatment, and be proud of that. Be proud of what you're doing. And maybe some of us were supposed to be relegated to the military or to nursing or to all these other, like, you know, stereotypical Asian jobs. We're in public health, and we want people to know that we're fighting for people to be present, not only in data, but in campaigns, on boards, be inclusive, but also sometimes be brave, even when you know it's not going to be probably the same outcome that you really want. Just stay the course.
I think it's important that we need to pay an homage to even the previous leaders, the older folks, and that's been doing the work. I think that even me, I want to still claim young, okay? I have a lot I still need to learn. And I feel that we need to be able to bridge some sort of conversation to maybe mentor the younger folks, to give the opportunity for the younger generation to be able to hold those positions, because this HIV epidemic has been going on for 40 years. What can we do as community members to continue that conversation, to continue the legacy and the work that our leaders have done in the API community? And I feel that it's important because we're still learning this process too. We're still trying to learn it. So if we could just bridge that conversation and maybe get mentored or be held accountable for our actions. And the thing is that we do come from different parts of the region, but there's only a few of us. You could only have so many audience members watch us, but if it means so much, why don't you come and help? Because there's more power in numbers, and we are accepting applications for the CAP. So fill it out.